COVID-19 has affected myself both personally and professionally. Back in March of 2020, something that we've never seen before, not allowing our families to be able to come in to visit the staff and the frontline people leaders, not just in our homes, but across our long-term care community, is next to none. The time away from their families to be able to support and care for our residents here.
I have a 97-year-old mother, and she resides at Macassa Lodge. She's 97, she's blind. This time of her life, I need to be with her, my brothers, my sister, anybody, and nobody can get in to see her. It's very sad. It's not like some people can pick up a phone and do FaceTime. She can't see. That just adds more anxiety, not only to her, but to me too.
I used to be a very athletic person, and now I'm a completely different person. I've kind of lost who I was and don't feel like I am the same person that I was before I had COVID-19. It's affected me both mentally and physically. Physically, I still am suffering from symptoms, extreme fatigue and weakness, body pain, joint pain, brain fog, and memory problems. Mentally, it's been really hard, increased depression and anxiety.
It's affected me both personally, as family, and professionally in running a childcare program. When COVID first started and we were mandated to close, it was very difficult because we thought, how are we going to sustain our program? We were concerned for our families, our children, and how we would manage. I feel at a loss because there's only so much we can do to help families. We're there for them. They're wearing masks and goggles, which is really hard when you're working with little children.
And most importantly, how do we keep the little people that come through our doors every single day safe? Particularly when it's hard to tell 2-year-olds, oh, don't share that, don't put that in your mouth, So we really had to roll up our sleeves and figure out those challenges.
When daycare is reopened, they have done everything they can to keep our center and our kids safe, and yet every day I drop my daughter off on the way to work, and every day I have to push aside feelings of guilt and worry. I get emotional just thinking about it. Am I making the right decision for her? Is she safe? I'm her mom. I'm supposed to protect her. At the same time, we have to work.
Being a frontline worker, there is an element that I could be worried of contracting COVID-19, but for myself personally, I do look after my health as a priority. The way that COVID-19 has impacted my life professionally has been put to a halt. We have a driver's lounge here where obviously we would congregate, get ready for our shifts. I can't high-five a colleague for a great job or sit down and eat lunch together.
Hi, I'm Joanne Santucci, Executive Director of Hamilton Food Share. When COVID hit, we had to reimagine everything. We had to reinvent processes. We had to make everything public health related in everything we did, times 13 organizations, and then in the middle of that with no volunteers and the local supply chain choked just in the middle of starting to order food that we needed.
The situation in shelters is really quite critical. It was before COVID and even more so now. One thing COVID has demonstrated is the ability within our community to really collaborate in effective ways between health care providers, community agencies, the City of Hamilton, volunteer organizations to respond with urgency and with compassion to ensure that people who need shelter are able to access it.
My name's Judee Parsons. I live in Ancaster, Ontario. I'm a single mother of a 23-year-old special needs child. I initially contracted COVID latter part of October. Taylor attended her day program back in August. It reopened again with safety precautions. I felt totally safe with sending her back. The latter part of October, I received a call from the program saying that there was a little guy that was obviously tested positive. Taylor was in that group. My experience with COVID was actually very terrifying. The initial thought process is hospital, ICU, ventilator. Having a special needs nonverbal child, it was very scary. The shortness of breath, the fatigue, the loss of sense of smell, the loss of taste.
As a recreational therapist, we're called to do a lot on the floor, whether it be doing FaceTimes with family members or just trying to find unique ways to, bring that morale up in our residents and, just find ways to have fun. I was diagnosed with COVID back in the first wave of 2020. During that time, my work had actually had gotten place for a bunch of us frontline workers to live in a hotel close by so that we wouldn't be able to possibly infect our families during that time. I was exhausted. I was sleeping maybe 14 hours of the day when I was in the hotel room. Also too, just a really high fever.
It was my week to do the groceries. So I picked up groceries for my mom and dad. On the Thursday morning, I went to their house. All I did was open the front door. I dropped off the bags of groceries. I waved hello and I left. On the Saturday of that week, Public Health contacted us and they told us that my mom and dad had been exposed to COVID and they were admitted into the hospital that Saturday evening. My son and I were also tested. We both tested positive. I was also admitted to the hospital. And I was also in ICU. And they actually put me in the room next to my mom. I think it was May 26th then, the doctors came in and told us that the COVID had taken over my mom's lungs. And I'll never forget what a nurse at the hospital told me when they did the x-ray of my lungs. She described it that your lungs look like they're filled with broken glass.
On a professional level, it's been exhausting. The case that stays with me the most is I've been working the COVID assessment clinics as part of the COVID effort. And earlier on, there was a man that came in who was short of breath, who was in his 60s, and he just came to get swabbed because he thought he should. He had nothing else wrong with him. We could tell he was sick, like sick right away. And I went into the room and he was just struggling to breathe. It was horrible to see. We called ambulance right away to the hospital and he was direct to the ICU, and he did not do well. And when I think of COVID, I think of him and the people who get that sick and what that looks like, and struggling to breathe. Struggling to breathe is a terrible way to die.
Putting all this equipment on. Patients get a lot of ease from us, from our smiles, from our voice, from our demeanor. If we're calm and assertive, then that puts them at ease. Covering yourself in PPE, they do not see our smile. They do not get reassured by our facial expressions, our body expressions.
In the early morning of May 27th, the nurses came, they woke me up, and they told me that my mom was very close to passing, and would I like to go in to be with her? She wasn't conscious at this point, so I said yes, I wanted to be with her. So they took me by wheelchair into my mom's room. I held her hand. I told her I loved her, and I told her it was okay for her to go. My mom was an 88-year-old woman, perfectly healthy, still socially active. She was still driving her car. Her death should never, ever have happened.